Hello, I am Mariana from iPrinted Pharma Research Group. I'm going to present my project titled 3D Printed Pharmaceuticals, a new approach for personalized chronic wound healing. There is a proverb that says, time heals all wounds. Does it really? Well, no, not exactly. This is Nigel Nrook, a 56-year-old man living with an ulcer on the same area of his foot since 2011. He is overweight, type 2 diabetic, and due to diabetes, he suffers circulatory problems that reduces the body's ability to heal injuries. This is a real problem, especially since diabetes also led him lose sensation in his feet. Nigel now is extremely desperate to find an effective treatment after trying all sorts of dressings available in the market within the past 11 years. Nigel is among many others living with chronic wounds. Then, what is a chronic wound? A chronic wound can be defined as an injury to the skin that is difficult to treat, lasts a minimum of 3 months, and is often a result of underlying major health conditions, mainly diabetes. And in this case, it's obvious that what Nigel is suffering is a diabetic ulcer. Chronic wounds are a very expensive financial burden, where more than 20 million people worldwide are currently living with chronic wounds, costing healthcare systems more than $20 billion annually. These numbers are continuously increasing with the current aging population, as well as the increasing rates of obesity and diabetes, which is now becoming a global epidemic. In addition to the huge financial cost, chronic wounds also have a high psychological load for the patients. Patients living with chronic wounds suffer severe pain, discomfort, anxiety, and reduced quality of life. They also feel embarrassed from the smell the wounds can cause. This physical and psychological distress not only impact the lives of those who are affected, but also negatively affect their own families. This leads us to the fact that chronic wounds are a major global healthcare challenge that gets very little media attention, which reflects what The Guardian described as the hidden health crisis. Despite the clear severity of the problem, little research has been done in this area in comparison to other medical fields. In the past decade, 3D printing of medicine has been a hot topic in the pharmaceutical field. It opened new ways for personalized medicine. This has been widely demonstrated as oral dosage forms. Now, it's time to use the same personalization as topical applications for wound healing. My research is focused on applying 3D printing to fabricate customized hydrogel wound dressings that fit the personal needs of each patient. This treatment approach will be more efficient, safe, and cost-effective, since physicians and nurses will be able to choose the size, shape, and the composition they need for the wounds of the patients. While, on the other hand, the dressings available now in the market are not flexible enough to match the variability of the wounds. Plus, they are expensive. Among the diverse 3D printing technologies, what we are applying here is VAT photopolymerization technology, in specific, digital light processing or DLP printing. This technology is superior and is known for its superiority in producing complex structures with its high level of accuracy, high resolution, and high printing speed, while avoiding the use of heat. In this process, the liquid resin, let's say the printer's ink, is selectively cured into a solid polymer under UV light exposure. This happens in a repeated layer-by-layer manner until the hydrogel structure is completed. But 1 second, we have a problem here. Most of the photopolymers routinely applied in this technology are not pharmaceutically approved or even recognized as safe. Thus, to overcome this problem, we are developing a resin formulation based on natural polymers. The polysaccharide under investigation is functionalized to become photocurable and then mixed with a suitable photoinitiator. In this way, my PhD research will not only give a better chance for people like Nigel to actually treat their chronic wounds, but will also introduce green, renewable sources of materials that can make 3D printing more environmentally sustainable and biocompatible. Now, seeing this, our cellulose-based bioink being printed into customized hydrogel scaffolds, we can say, yes, time can heal wounds, and in our case, in few minutes. Thank you.